NCSB NCLEX practice exam, my results and what I learned. Question 1. A nurse is caring for an infant that has recently been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? Option A, slow pulse rate. Option B, poor weight gain. Option C, decreased systolic pressure. Option D, irregular white blood cell lab values. The correct answer is option B, poor weight gain. Infants with congenital heart defects exhaust quickly during feeding, burning more calories than they take in, leading to poor weight gain and failure to thrive. Question 2. A patient is getting discharged from a skilled nursing facility. The patient has a history of severe chronic obstructive pulmonary disease. The patient is primarily concerned about his ability to breathe easily. Which instruction is best? Option A, deep breathing techniques to increase oxygen levels. Option B, cough regularly and deeply to clear airway passages. Option C, cough following bronchodilator utilization. Option D, decrease carbon dioxide levels by increased oxygen intake. The correct answer is option C, cough following bronchodilator utilization. Using a bronchodilator opens the airway first, making a subsequent cough highly effective at clearing out deep secretions. Question 3. A 50-year-old blind and deaf patient has been admitted to your floor. As the charge nurse, your primary responsibility for this patient is? Option A. Let others know about the patient's deficits. Option B. Communicate with your supervisor your patient safety concerns. Option C. Continuously update the patient on the social environment. Option D. Provide a secure environment for the patient. The correct answer is option D. Provide a secure environment for the patient. Safety is the absolute priority in nursing care. A patient with dual sensory deficits is at a severe risk for injury, making a secure environment paramount. Question 4. A patient has taken an overdose of aspirin. Which of the following should a nurse most closely monitor for during acute management of this patient? Option A, onset of pulmonary edema. Option B, metabolic alkalosis. Option C, respiratory alkalosis. Option D, Parkinson's disease type symptoms. The correct answer is option A, onset of pulmonary edema. Severe salicylate poisoning can cause increased pulmonary capillary permeability, leading to non-cardiogenic pulmonary edema. Question 5. A new mother has some questions about phenylketonuria. Which of the following statements made by a nurse is not correct regarding phenylketonuria? Option A. A Guthrie test can check the necessary lab values. Option B. The urine has a high concentration of phenylpyruvic acid. Option C. Mental deficits are often present if untreated. Option D. The effects of phenylketonuria are reversible. The correct answer is option D. The effects of phenylketonuria are reversible. Neurological and cognitive damage caused by the buildup of phenylalanine in the brain is permanent and cannot be reversed, though diet can prevent further damage. Question 6. A patient's chart indicates a history of meningitis. Which of the following would you not expect to see with this patient if this condition were acute? Option A, increased appetite. Option B, vomiting. Option C, fever. Option D, poor tolerance of light. The correct answer is option A, increased appetite. Acute meningitis presents with severe nausea, vomiting, fever, photophobia, and a stiff neck. An increased appetite would not be expected. Question 7. A patient's chart indicates a history of ketoacidosis. Which of the following would you not expect to see with this patient if this condition were acute? Option A, vomiting. Option B, extreme thirst. Option C, weight gain. Option D, acetone breath smell. The correct answer is option C, weight gain. Diabetic ketoacidosis results in profound cellular dehydration and diuresis, leading to severe acute weight loss, not weight gain. Question 8. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? Option A, decreased heart rate. Option B, paresthesias. Option C, muscle weakness of the extremities. Option D, migraines. The correct answer is option D, migraines. Hyperkalemia alters the electrical gradient of cells, causing cardiac dysrhythmias, paresthesias, and muscle weakness, but it is not directly linked to migraines. Question 9. For which of the following conditions would a nurse not administer erythromycin? Option A, Campylobacteriosis infection. Option B, Legionnaire's disease. Option C, pneumonia. Option D, multiple sclerosis. The correct answer is option D, multiple sclerosis. Erythromycin is a macrolide antibiotic used to treat bacterial infections. Multiple sclerosis is an autoimmune disease, so an antibiotic is completely ineffective. Question 10. When you are taking a patient's history, she tells you she has been depressed and is dealing with an anxiety disorder. Which of the following medications would the patient most likely be taking? Option A, amitriptyline. Option B, calcitonin. Option C, pergolide mesylate. Option D, verapamil. The correct answer is option A, amitriptyline. Amitriptyline is a tricyclic antidepressant commonly prescribed for treating both clinical depression and severe anxiety disorders. Question 11. A nurse is making rounds taking vital signs. Which of the following vital signs is abnormal? Option A, 11-year-old male 90 beats per minute, 22 breaths per minute. Option B, 13-year-old female 105 beats per minute, 105 over 50 millimeters of mercury. Option C, 5-year-old male 102 beats per minute, 90 over 65 millimeters of mercury. Option D, 6-year-old female 100 beats per minute, 90 over 70 millimeters of mercury. The correct answer is option B, 13-year-old female 105 beats per minute, 105 over 50 millimeters of mercury. A diastolic pressure of 50 in a 13-year-old is considered abnormally low and presents a widened pulse pressure that warrants investigation. Question 12. A young adult is 20 years old and has been recently admitted to the hospital. According to Erickson, which of the following stages is the adult in? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. According to Erickson, the primary psychosocial task of young adulthood, ages 18 to 40, is forming intimate, loving relationships with other people. Question 13. A toddler is 26 months old and has been recently admitted to the hospital. According to Erickson, which of the following stages is the toddler in? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Between ages 1 and 3, toddlers are developing a greater sense of personal control, navigating the stage of autonomy versus shame and doubt. Question 14. A 5-year-old child has been recently admitted to the hospital. According to Erickson's psychosocial development stages, the child is in which stage? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Preschoolers, ages 3 to 5, assert their power and control over the world through directing play and social interaction, placing them in the initiative versus guilt stage.